Who lives, who dies, who gets priority to a ventilator?
I think it's a very complex ethical dilemma.
We've never had this situation before. This is unprecedented.
Bioethicists say widespread infection, protective equipment, and ventilator shortages are creating unique ethical dilemmas for healthcare workers.
We will start to care for the person who is at risk of dying first. But if we have more people than resources, then we have to try to save those that are savable.
The obligation for a healthcare provider to treat their patient doesn't necessarily have a limit.
In Spain, some 13,000 medical workers have been infected. In Italy, more than 60 workers have died since the outbreak began.
It's not just their life. They can assume this risk for themselves, but they also, if they don't have right equipment, they also have the risk of infecting other patients, other healthcare providers, their family.
Some health systems around the country are reportedly discussing unilateral do not resuscitate policies, something debated during the Ebola outbreak in 2015.
How do you, from an ethical standpoint, decide which patient gets the treatment and which one doesn't?
We think about it very carefully and with great deliberation.
In Italy, that meant denying some care to the elderly in favor of the young. Glugman says in Illinois, a pandemic flu plan created a decade ago includes care procedures built around ethical frameworks and algorithms that help decide who should, for example, get a ventilator.
We have to consider things like, what is our most important value? So the value that we're considering is maximizing the number of years of life that we can save.
Ultimately, they say a balance must be struck.
You have to make sure that the benefit of the patient overrides the harm or the risk that you're getting in.
Otherwise, bioethicists say there may not be enough first responders to treat the infected.
When you call 911 because your loved one can't breathe, there will be nobody coming. That's the worst case scenario.
Reporting from Chicago, I'm Usher Qureshi.